How soon do STD symptoms appear after exposure? Have you ever wondered how quickly you might notice symptoms after being exposed to a sexually transmitted disease? The time it takes for symptoms to appear can vary greatly depending on the specific infection. Some STDs can show symptoms within just a few days, while others might take weeks or even months. In fact, many people may not notice any symptoms at all initially. Let's break down the typical onset times for some common STDs. For syphilis, the first symptom is usually a painless sore known as a canker. This sore typically appears between 10 and 90 days after exposure, with most cases showing symptoms around 3 weeks or 21 days. Chlamydia and gonorrhea are bacterial infections that often cause symptoms within 1 to 3 weeks after exposure. However, many individuals, especially women, may not experience any symptoms. If symptoms do occur, they might include painful urination, unusual discharge, or pelvic pain. When it comes to herpes, symptoms like painful blisters or sores usually develop within 2 to 12 days after exposure. The first outbreak tends to be more severe, and the frequency of recurrent episodes can vary from person to person. For human immunodeficiency virus, or HIV, early symptoms can appear 2 to 4 weeks after exposure. This stage is sometimes referred to as acute retroviral syndrome and may resemble flu-like symptoms such as fever, sore throat, and fatigue. However, it is crucial to note that many people may not notice symptoms 4 years after exposure. Human papillomavirus, or HPV, is another common infection. Most HPV infections do not cause any symptoms and may clear up on their own. When symptoms do occur, such as genital warts, they can appear weeks to months after exposure. It's essential to understand that many STDs can be present without any noticeable symptoms, especially in their early stages. This means that individuals can unknowingly transmit infections to others. Therefore, regular testing after potential exposure is vital, regardless of whether symptoms are present. If you suspect you have been exposed to an STD or notice any unusual symptoms, it's important to seek evaluation and testing from a healthcare professional as soon as possible. Early diagnosis and treatment are key to preventing complications and further transmission. Remember, the timeline for symptom onset can range from a few days to several weeks, and some infections may remain silent initially. Regular screening and consultation with healthcare providers are essential components of maintaining sexual health.